Welcome, everyone. My name is Jess Posner. My pronouns are she and they, and I am the director of the Virtual Y at the YMCA of Central New York. I am a white woman in my 30s with brown hair, wearing glasses and a black top. The background behind me is a dynamic blue and purple virtual background. I am so excited to welcome you to today's virtual Lunch and Learn, the ABCs of Medicare Benefits with Kayla Wight and Ericka Gray. Kayla Wight and Ericka Gray will present an overview of Medicare parts and provide an understanding of open enrollment periods throughout the year. They will provide guidance on the extra benefits your Medicare plan offers and how to navigate using those benefits to your advantage to better your whole self. Kayla Wight is an Aetna Community Development Coordinator with over 10 years of experience in the healthcare industry focused on Medicaid and Medicare. Kayla works with community partners to provide education and awareness around the Aetna Medicare programs. Ericka Gray is an Aetna Retention Manager and has been in the insurance industry for over 15 years. Ericka is excited for this opportunity to develop relationships with our Medicare population. Aetna is helping people live healthier lives. An estimated 39 people rely on Aetna, a CVS Health company, to help make decisions about their healthcare and healthcare spending. Every day, we work to make the system easier and more convenient for their customers. Aetna Medicare Solutions provides Medicare Advantage and dual special needs plans that offer benefits including dental, vision, hearing, and fitness, in addition to medical and hospital coverage. So without further ado, I'd love to turn the stage over to you, Kayla and Ericka.
Thank you so much. That was a wonderful introduction. We really appreciate it, and we appreciate the audience taking a moment to listen to our presentation today. Really, just again, as my title suggests, I do a lot of the community development, networking, and it's really based off of a grassroots model. So we always want to present it as, more of an education piece as well. So, and welcome to, Stephanie, for just joining in. We're going to play a short video to start. Hi there. Okay, so give me a moment. Sometimes I think I'm really great at technology, and we tested it, so I'm confident, but bear with me. Again, this will just be a 1-minute short video. Jess, I know just from earlier, how is it looking on your end? Do I need to make any adjustments?
You're looking good.
Perfect. Thank you. Okay, I'll go ahead and play.
We know Medicare can be complicated, and that you likely have questions about what kind of coverage and plan is right for you. We know you want a Medicare plan that takes care of the whole you, a plan with the right benefits and coverage, a plan that best fits you and your personal health goals. We're here to answer your questions, and we'll make sure you understand everything you need to know to choose the best plan for you. We have affordable plans to help you keep costs low, with plan premiums as low as $0 a month, and a limit on your out-of-pocket costs. Depending on the plan you choose, you could enjoy benefits like an over-the-counter allowance with as low as $0 lab services and $0 preventive services like routine screenings. Plus, help and support is here for you when you need it. We also give you essential benefits to keep you at your best, with dental, vision, and hearing coverage included in most plans. All of this comes with the strong Aetna network of trusted local doctors, hospitals, and specialists. So you get the care you need and deserve. So when you have questions, we're here to help. At Aetna, we'll be right by your side, helping you find the right plan, giving you the tools, the guidance, and all the support you need so we can make healthier happen together.
All right, so that I think is a great little introduction to Aetna and what we do here. Again, many people know Aetna from a commercial standpoint, but there is a Medicare line of business that we offer, and that's what Ericka and I do across New York State. So today, as far as our presentation goes, I mentioned the education piece. We want to keep it relatively general, because we know we are going to have people joining us that are not Aetna members. But we will obviously touch on some specifics of Aetna, just for relevance and whatnot. And the other thing that we like to make note, and again, after, all my experience in the healthcare industry, the question I get a lot is, they're standing in front of you. What's the best plan? And the expectation is you're going to answer, well, of course, the plan I work for. And of course, we believe in what we do, but we also, our plan is the best plan for some, for most, but not for everybody. And that's why there's options. And I think that's really important as, we're sort of, stewards of this industry, and healthcare is be so confusing. It can be so layered. Medicare is a whole other beast in itself. It can, be hard to understand. So we really recommend somebody, if you're not comfortable knowing, have an advocate with you, or, make sure you're talking to somebody in person, because we want you to make sure that you're choosing the best plan for your health needs, and understanding that your health needs may change year to year. And that's a great time. And Erika will talk a little bit about the different enrollment periods throughout the Medicare, process and lifetime, and how you can make those changes. But it's certainly worth to look at year to year. But we also really, really promote making sure that you're making the decision based off of your health needs, and not what, somebody that's sitting in front of you trying to enroll you in thinks is the best plan for you. So I just kind of want to give that disclaimer. I think that's super important. And usually the point we try to make when we are out in the community. So we'll go ahead. I'll share my screen again, if it wants to cooperate with me. There we go. And we'll get started with the presentation. Okay, Jess, I'm going to rely on you again. How does it look?
So you've got to go up and swap that display settings again.
Oh, yeah. Okay. Good.
There you go.
Okay, perfect. Thank you. I will never stop appreciating you for that. Okay. So, there we go. Okay. So, again, I'm Kayla. With me, we have Erika, and our titles are listed at the top. And Jess, thank you again for the really beautiful introductions. So to get started, and I do apologize, when I go into the share screen, I can't see anybody else. So please don't hesitate to stop me if there's either a question or something isn't working right. So the ABCs of Medicare, really breaking it down to simplify, there's 3 parts of Medicare: A, B, and D. And then what Aetna is, we are a Medicare Advantage plan. So we are considered a Part C, which would then encompass parts A, B, and D all under one plan. So we'll kind of go through that on the next slide. But, again, not trying to read what's in front of us. You have Part A, which is your hospital insurance. And then again, most people will not have to pay a premium for Part A. And that is automatic when you turn to the age of 65. Part B is the medical portion, and that usually has a monthly premium. And of course, there's other resources. And if we have time today, and I'll look to my colleague Erika to help maybe go through that within the next few slides. There are sometimes ways that you can get support in paying for Part B premium. And that's where you would really want to work with, somebody from a health insurance company, or even a broker, whatever you're comfortable doing, to help guide you through that. So together, Parts A and B make up the original Medicare, which is provided by the government. So then you see Part C, which I sort of explained already. It's going to cover Part A, B, and D into one plan, and Part D is your prescription drug coverage. So the thing that I always get asked or told when I'm sort of explaining what a Medicare Advantage plan is this is too good to be true. And it truly is a really amazing program as far as that goes, because premiums within a Medicare Advantage plan are typically going to start at $0. Again, it's going to encompass your medical, hospital, and prescription drug coverage, along with many other benefits that we'll get into in a moment. But, you know, you're looking at dental and vision and fitness, which I'd like to pause here. Our fitness vendor is Silver Sneakers, and the YMCA is a Silver Sneakers participant. So you can utilize a free gym membership at the YMCA of Central to New York. So we're really excited for, you know, that and that partnership. It's a great program. There with the Advantage plans, you're going to have often different options as far as in network and out of network, or your HMO or PPO, which is the most common language for that. So and then, you know, again, Aetna is just one of the many options for a Medicare Advantage plan. So what original Medicare doesn't cover, again, trying not to read the slides, but, you know, there may not be, you know, a cap on your drugs or out-of-pocket spending, which that's another benefit of a Medicare Advantage plan. So you're going to see those types of benefits as well. So I'll leave this here for a moment so folks can kind of just take a look at the verbiage listed on the screen. And if anyone needs support, obviously they can reach out to us after.
Kayla, can I just add something?
Please.
Yes. So the difference is when you have a Medicare Advantage plan, so when you have Part C, because Part A with original Medicare, you have a deductible. So you're going to have a deductible for your hospital. When you have an Advantage plan through an insurance carrier, that's your Part C, it's all co-pays with a premium, if a $0 premium or with a premium. So I just wanted to add that in there.
Thank you. No, that's a great,
Sure.
Great call out. Perfect. Okay, some basic Medicare coverage options. You can take the original Medicare, which is parts A and B, and then pay out of pocket for, you know, the other parts. But then again, to what Ericka's, you know, point is making is, some of the, you know, deductibles that are turning into co-pays and whatnot. And Ericka, I don't know if you have anything else that you would like to add. I mean, there's also, which we don't have a supplement, not in our area that I'm aware of. Supplement plans are also out there, but they can be costly, but again, sometimes necessary based off of your health needs. But Ericka, looking at this, I don't know if there's anything else that you would like to add. I don't know if some of it's a little was explained already, but.
No, you're good. I just think, you know, I think a lot of people just, you know, with parts A and B, that's all through Social Security. That's all through original Medicare. So, you know, we never want to steer anybody where they're not comfortable, but it's always better to have an Advantage plan just because of the wide range of doctors with an insurance carrier. And you're getting more. You're getting all those added benefits, dental, vision. With original Medicare, you don't have dental and vision, and you have to purchase prescription coverage. So with Part C through an insurance carrier, Part D is included in those plans.
Perfect. Thank you. Okay, so I'm going to hand it off to Ericka, and she's going to discuss the next few slides.
So there are Medicare Advantage enrollment periods. So your initial enrollment period is when you turn 65. So what that is, it's a 7-month window. So it's 3 months before your 65th birthday and 3 months after your 65th birthday. The open enrollment period is every year. It's October 15th to December 7th, where you can change your plan or drop a plan. What this is I always like to tell people, you're never married to your plan. So you can always change your Medicare plan every year. You may need certain services that one plan doesn't offer or need more coverage. So you can always change your plan. So during that open enrollment period, you're not really locked in yet. So if you like your plan and you don't want to change, then you're all set for January 1st. After the open enrollment period, you go to, or I'm sorry, yeah, there's another open enrollment period. So actually, the October 15th to December 7th is the annual enrollment period. Kayla, I don't know if that's, so January 1st to March 31st is the open enrollment period. So what that gives you, these members, is they're able to change their plan one time. They can switch to another Medicare Advantage plan, or they can switch to original Medicare. So you do, if you want to make a change and you're not really sure about the plan that you picked, then you can make that change between that time period.
And this information was taken right off of Medicare.gov.
Yeah, I know, that's what you said.
I know.
Yeah.
For us folks in the Medicare biz, we're like, wait, we call it
Yeah.
AEP, annual enrollment period.
I
So sorry for that confusion. Again, my efforts in trying to make this wide range and sort of unbiased in a sense for everyone viewing it, but this was right from Medicare.gov. But yes, so you will hear the term AEP, or annual enrollment period, and just to clarify, it's that October 15th through December 7th. And then as you can see, January 1st through March 31st is the open enrollment period if you're on an Advantage plan, which we're right in the middle of that. So yeah, sorry, Erika.
No, that's okay.
Okay, I'll go to the next slide for you.
Thank you. Okay, so there are plans. So all Medicare Advantage plans offer additional benefits outside of the medical and hospital coverage. And that could include dental, vision, hearing, fitness, chiropractic, acupuncture, health rewards, behavioral health, and case management. Now, there are, like, our fitness is through Silver Sneakers. Every health, a lot of different Medicare Advantage insurer carriers offer different locations for fitness. So it does depend on what type of insurance carrier that they have. But all of these services are not covered through original Medicare. These are services only covered through an Advantage plan. Okay, so this is the Healthy Rewards program. A lot of insurance companies do have the Healthy Rewards program. They are different for each carrier. Aetna does offer $200 redeemable for members that stay healthy. They can redeem them for gift cards, and a couple of examples are they can complete a healthy home visit. That would give them about $50, or they complete their annual wellness visit. That could give them $35. Listen and watch health educational series, get your annual preventative screening, stay on track with diabetes care if you're a diabetic, or get your annual flu shot or COVID vaccine. You can also earn money. So it is free. I consider it free money. Everybody wants free money at that end of the year, especially around Christmas time. So I like to remind people that they do have this, and you do have to redeem them by December 31st or they're gone. So we want to make sure that members are getting that. And again, it is only available with Aetna Advantage plans.
So if you're not on an Aetna program and you have another carrier, the best way to find out what your plan offers is either to call, if you use a broker, or if you use a representative directly from that plan, reach out to them. If you don't have those resources, or you don't remember who you spoke to, just call the number on the back of your card. And that's always the best way to sort of figure out some of the things that you might be missing out on, or if you feel like you need support with case management, you have a chronic disease or, something of that nature, you want help with, diabetes management, certainly reaching out to your health plan directly. They will always direct you on, where you need to go. And as Erika said, it's, every plan is going to differ a little bit. Some use the same vendors. So for example, like our hearing benefit is through Nations Hearing. And I believe our vision is through iMed. Am I getting that right?
iMed. Yep.
Okay. And then, fitness, I mentioned Silver Sneakers. We have the Healthy Rewards. So, and another thing, we always encourage going to your primary care provider. And usually they're very much aligned with a lot of these things. So the things that Erika just mentioned about what you can do to redeem these rewards really aligns with ensuring you're staying up with your preventative care. So just to kind of tie that in with that. Erika, did you have anything else to add in terms of that?
No, thank you for piggybacking off of what I said and doing that extra. Thank you.
We really, a lot of insurance companies, and again, that's speaking generally just from past experience and with Aetna, we're really, the whole healthcare system is moving towards sort of combating these social determinants of health and the barriers that people face when they're trying to take advantage of their healthcare. And I think that's why it's super important to highlight a lot of these things that we're talking about. The more that we can educate the community, or even Jess at the Y, and she encounters somebody, it's that, word of mouth and trickle down effect that we really hope to accomplish there. And even, again, primary care providers, specialists, they're all moving towards that direction too, and really looking at more of a value-based system instead of just, getting you in and out. So another way that you can take advantage of maybe looking at some different resources available to you outside of your medical and hospital benefits is through the National Council of Aging or Benefits Checkup. So we provided the website there and a little bit about the National Council of Aging. Great, organization. Aetna is one of the sponsors for that agency, and they're really designed to empower older adults to try to find the resources available to them if they don't have somebody to help them. So anyone can access Benefits Checkup. We provide the service as a part of just what we do every day. And in fact, we actually hold specific events sometimes that is designed just for Benefits Checkup. You can come hang out with us. We can do it on a group basis or an individual basis. And really at the core, you go to the website, you put in your zip code, and what it's going to do is sort of spit back at you some of the things available to you within a certain radius of where you are, whether it's food support, housing support, legal support. And the list goes on and on. So it's a great tool, super easy and intuitive to use. So again, we can help you. You can utilize it on your own or an advocate, whatever you choose, or hopefully you come see us at an event sometime. That concludes our presentation. Truly, my information and Erika's information is listed there for you. And so, we really appreciate everyone taking a moment to listen and understand a little bit more about Medicare and what options you have available to you. I'm going to stop sharing now, and I'll kind of pause there and see if any of our attendees have questions for us that we can help answer.
Well, thanks so much. On behalf of the YMCA of Central New York, I just really wanted to thank both you, Kayla and Erika, for providing us with so much information to help our members and friends, really better understand what their options are and what to look forward to as they age into the system. I do have a few questions. If anyone else with us has any questions, feel free to go ahead and raise your hand and I will call on you. So great. So the first question that I'm just going to ask to get us started is what if you're about to turn 65, what do you need to do? Or if I'm like trying to help someone maybe that is about to turn 65, how do we get started?
So what you're going to want to do is, I always tell people they have to apply, they have to contact Social Security. So there's a certain window where they have to work a certain amount of hours to put into Medicare. So they definitely want to look, and all of this information, Jess, is on Medicare.gov. Okay. There is so much information on Medicare.gov. People can ask questions on, in the search bar. I still have a lot of success looking up looking up information on Medicare.gov. But what they're going to want to do is they're going to want to contact Social Security. The minute they turn 65, they're going to be automatically enrolled in Part A. In order to enroll in the Medicare Advantage plan, they have to enroll in Part B. They do have to get Part B. There are certain circumstances when they don't have to. If they don't in a certain amount of time, they will have a penalty. So they should be contacting the Social Security Administration if that's the first step.
Okay, thank you so much. I see that we have a question from Stephanie in our audience.
Hi, and thank you for your presentation. I had a question around the fitness parts of things. Obviously, I work in that kind of field. And one question I had was, do you find that certain plans are catered more towards someone aging without major chronic diseases, and some plans are gauged or they have different options in there for someone who does have more chronic diseases?
I know we probably won't be able to talk about specific other plans, but in terms of Silver Sneakers, our vendor, which again, other plans utilize that vendor. And I actually don't know what my previous life's company, I can't remember what their fitness benefit was, but Silver Sneakers, I rave about it. And that's not paid advertising here. They're just, I've worked with the local representatives. They're amazing to work with. They are really dedicated. And I believe that they have an array of options on their website too. So not only can you take advantage of a fitness center, and there may be some extras, like I'm not sure, they may not always cover like the pool or that type of thing. That may be an extra cost. I'd have to look into that a little bit more if somebody had questions, but they can also do things online and watch at-home videos, which may tailor more to their needs if they can't get out of the house because of whatever their chronic disease is and they have mobility issues or transportation. They can take advantage of this all online. And just as robust as like Medicare.gov, Silver Sneakers is just as robust too. And it goes beyond just the fitness part too. And they have some like mindfulness things hanging out on there, which is really nice. We always try to align what we do with the like health awareness months and things like that. So I don't know if that fully answers your question. But I do think they allow like different levels, and I've been there watching their tutorials that they do. And it's very, at that person's comfort level. And as they go through, like, if you can't raise your arm all the way up, try this, so I think that they're just Jocelyn and, there's one in Syracuse. Jocelyn's out in the Western area. They've been wonderful. So they're great instructors too. So
thank you.
Of course. And if you want to email me, or I can give you my phone number, I can always send you some flyers for Silver Sneakers. They'll give you a little bit more information about some of the literature that's around there, especially if you're in that field of work.
One other question I have, so we offer a program now, National Diabetes Prevention Program, which is covered by Medicare.
Mhm.
Now, would that be something that is covered under a specific part of Medicare? Like A, B, is it B that it's primarily covered under? Or uh, the the program itself? I think it is B, but I wasn't sure if you knew.
I'm kind of looking to Erica for that because I'd have to get out
Yeah.
my plan guide and see
Yeah.
what that would fall under.
And that's okay. I was just
Mhm.
wondering if you guys just have had experience with the program and covering it through Medicare. And because like you had mentioned with the social determinants of health, that's what we're trying to do, is be able to
Mhm.
program to people in, areas of most need. And then once we run the program, if we have sparked interest into things like silver sneakers, where does that translate over and how easy is it to translate over? And say somebody is on standard Medicare and having this covered for them, guiding them towards Aetna to have a Part C, so that silver sneakers could then become a tool for them.
Sounds like we should talk after this presentation sometime to give you some more
Yeah.
really tailored down information that you can utilize, more individualized, so that you can help guide folks. So
What program was it, Stephanie?
It's the National Diabetes
National
Prevention.
Okay.
And there might be some other programs. We are also bringing on the Chronic Disease Self-Management Program, which I think is possibly covered by Medicare, but I don't know for sure.
Okay.
we can definitely follow up with you for sure.
Yeah, I'll definitely look
Mhm.
into that, and I'll follow up.
Thank you.
Yeah, Steph is one of our amazing staff people who runs so many of our healthy living programs, and is one of the first faces that a lot of people meet when they get enrolled in some of these healthy living programs that we offer at the Y. And I just wanted to say thank you to all of you for that really interesting, sort of like moment of discussion there, and how these things kind of interact with one another and how they intersect. And also, I just wanted to call back up the sort of really wonderful resource that Silver Sneakers is. We have a lot of members who use the benefit, and they've mentioned that Silver Sneakers has its own kind of online and virtual programs, but we also have one at the Y. So with your membership to the YMCA of Central New York, through Silver Sneakers or otherwise, you also have access to the virtual programming that we do, and we have many members that take advantage of that. So it's a pretty cool way to use the robust offerings of at least the YMCA of Central New York in concert with, the benefits that you may have with your health plan. So
it's such a great point, because I think
yeah.
even for myself, I don't know all the wonderful things that the Y offers. And I think to your point, Jess, it's great. I'm hoping that somebody out there watching will now, take this back and be like, oh my gosh, I didn't know that, the Y did that. Because you also offer so many things that we just scratched the surface in this moment, but
yeah, and I can tell you that at least at the Y, the pool is included with all of our memberships.
okay.
So we may not have, at least with the Y of Central New York, all of our locations may not have a pool, but those that do, as soon as you kind of swipe in the door, once you're a member, so we've got that covered too. So I have just kind of two more questions, if you guys are cool with that. Okay. So I was just curious. So for our friends that may be watching this video on YouTube or on our virtual Y platform, I just want to let you know today is February 14th, 2023. You mentioned briefly that open enrollment is now, or in the middle of it. Can you just kind of refresh us on when those periods are every year? And what they mean, just to kind of clarify which ones you can do what in.
Sure. Do you want me or you, Erica? Do you want to take that?
I'm so sorry, Jess. My whole computer just froze as you were talking. Can you repeat the question?
Sure. It was just sort of asking. So, because we have friends who are going to be watching this online, out of real time of when the presentation is. So today is February 14th, 2023. Happy Valentine's Day to those that celebrate. And I was just curious if you could tell us, just remind us of when the open enrollment periods are and what that means. If there's two of them, what is the difference between the two of them? And, how can we kind of understand those time periods for open enrollment a little bit better?
Yeah, so it's the initial enrollment period. So it's a 7-month window, 3 months before your 65th birthday, the month of your birthday, and then 3 months after. So you have that window to apply for Medicare. And then there's the annual election period, which runs from October 15th to December 7th. So that's when you want to make a plan change or enroll in a Medicare plan for January 1st effective date. Okay. Then you have the open enrollment period, which is January 1st to March 31st. So you have one time. So let's say you enroll in a plan and then you kind of do a little bit more research and you're like, oh no, I wish I enrolled in this other plan. You have that open enrollment period window to make a change. You can change to another Medicare Advantage plan, or you can go to original Medicare. Now, you don't have to stay in that. I just want to point this out there. Let's say you're enrolled in Aetna Medicare Advantage plan. You can switch to a different insurance carrier. So I just want to know, information. So you don't have to switch to another insurance plan with the same carrier. So you can switch carriers. You only have one time to change it.
Okay. All right. Thank you for clarifying that.
And actually so not to get more in the weeds, but sometimes there may be special enrollment periods throughout the year that somebody may qualify for if they are in need of making a change or find that, their plan isn't working. So that's when they should reach out to, somebody like myself, Erika, somebody present that works for Aetna somebody that's not present right now that is on the Aetna team is Erin Cordova, and she is our field service representative. So, yeah,
there are some insurance carriers that are 5-star plans where they do have special enrollment periods where you can make a plan change or enroll. So there are certain carriers out there that do have that eligibility to do that. Or if you get extra help, let's say a member is low income, they do have special enrollment periods where they can also make a plan change as well. It just all depends on the situation.
So we've got like a couple of general open windows that apply to everybody. And then depending on your personal situation, there may be some other opportunities to make changes as reflected into your needs.
Yeah. And when these members meet with the field sales representatives through insurance carriers, they'll discuss that with them as well. They'll make sure they understand everything. The field sales representatives will make sure their doctors participate in the plan. They'll go over any prescriptions that they take, make sure they're covered. So they will get more information when they sit down with somebody, so they're not confused and know exactly what they're getting. So I think it's very important.
And I don't know if it's worth mentioning, Erika, too. So we're talking about just Medicare Advantage. There are individuals that are eligible for dual Advantage plans or that dual special needs programs, which are Medicare and Medicaid. So we've been talking all along in regards to when you turn 65, that's when you can obtain Medicare, but there's individuals that are younger than 65.
Disabled.
That are disabled that can be on an Advantage plan because of a qualifying disability status. So that's a whole other, discussion. But if they, anyone again watching has questions, they should really know what benefits they could be missing out on too, because those plans are, typically very rich and robust to accommodate those dual special needs. So.
Well, thank you so much for that. It leads right into my next question, which is if people wanted to connect with you all to speak about their specific situation or to learn more about possible benefits, or to perhaps make some changes to their current plan, how is the best way for people to get in touch with you all? Like, do you have an office, or sort of like, how does it work with Aetna?
So Aetna, we do not have local offices. Our main office is located in Connecticut and New York City. But the people that we have sprinkled throughout the state are all local. So if you call my number, it's going to be me. It's not 1-800. You don't have to go through prompts. And then, my email is listed. So you can call, text, email me. And I would either be able to help you directly, same thing with Erika, or we would get you out to an enroller so we can come to your home. So we really pride ourselves on kind of meeting you where you are. If you're not comfortable with us coming to your home, we can certainly have discussions over the phone and complete the application process if that's the direction you want to go in over the phone. Or you can meet us just out in the community anywhere that you're comfortable. We do have different events and sites kind of throughout the area, so we could always accommodate, based off of those needs too. So.
All right. Well, thank you so much. I really learned a lot today, so I feel prepared to, help folks in my life navigate this when they're ready, and when I get there myself, through whatever means. I guess I just wanted to extend some sincere gratitude from the YMCA of Central New York, and also just ask both of you if you have any closing thoughts that you'd like to leave with folks.
If it's very confusing, Medicare. So we are here to help. Kayla, myself, we will, if you have any questions, we'll get you to the right area, get you to the right person. We know it's confusing, but we are here to help, and we are excited to work with you. Yeah. And thank you so much.
And I'm going to speak for Erika because she's been a huge asset to the organization. She and I have similar starting dates with Aetna. So we started almost exactly a year apart. So she, with her extensive experience, she's doing an amazing job with the retention role. And I think that's very unique with us right now. And she's going to be starting to do member meetings. So if we do have any members out there that, we'll certainly hopefully be able to utilize the Y as sort of a resource to get that information out, especially if you have people coming into your facilities that we might be able to direct to Erika to get that extra support. So just a final thought on that as well. It's going to be a great benefit to our members.
All right. Well, thank you so much. And we certainly look forward to seeing you all out in the community.
Oh, thank you again. I hope everyone has a wonderful Valentine's Day, rest of your week. And Stephanie, please get a hold of us and we can get you some additional information more specific to your program. So, of course. Thank you, Jess.
Thank you.
You are wonderful.
Have a good day, everyone.
Have a good day.
Thanks so
Bye.
much. Bye.